Greetings. Today, we're diving into 6 categories of foods that may increase cancer risk. It's important to understand that the risk often comes from chronic exposure to these foods, which can lead to inflammation and cellular dysfunction, particularly in the mitochondria, the energy factories of our cells. When mitochondria are damaged, cells may resort to a less efficient energy production method called fermentation, potentially leading to uncontrolled cell growth characteristic of cancer. 1. Alcohol. Regular, excessive alcohol consumption can damage mitochondria and increase cancer risk. Alcohol is associated with an increased risk of several cancers, including those of the mouth, throat, esophagus, liver, breast, and colon. Limiting alcohol intake can help reduce these risks. 2. Trans fats. Trans fats, often found in partially hydrogenated oils used in many processed foods, can harm mitochondrial function. These fats are linked to increased inflammation and have been associated with a higher risk of certain cancers. It's advisable to check food labels and minimize consumption of trans fats. 3. Charred meats. Cooking meats at high temperatures, especially until they're charred, can produce harmful compounds like heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. These substances have been linked to an increased risk of cancer. To reduce exposure, consider using gentler cooking methods and incorporating spices like garlic and rosemary, which may help mitigate some of these risks. 4. Processed meats. Processed meats, such as bacon, sausages, and deli meats, often contain nitrates and nitrites used as preservatives. These compounds can form carcinogenic substances in the body, increasing the risk of colorectal and stomach cancers. Limiting intake of processed meats can be beneficial for cancer prevention. 5. Ultra-processed foods. Ultra-processed foods, including packaged snacks, sugary cereals, and ready-made meals, are typically high in added sugars, unhealthy fats, and artificial additives. Regular consumption of these foods is linked to weight gain and obesity, which are risk factors for various cancers. Opting for whole, minimally processed foods can help reduce these risks. 6. Foods high in added sugars and refined carbohydrates. Diets high in added sugars and refined carbs can lead to obesity and increase the risk of certain cancers. These foods contribute to elevated blood sugar levels and insulin resistance, which may promote cancer development. Choosing whole grains and limiting sugary foods can support better health. Understanding these risks empowers us to make informed dietary choices. By reducing chronic exposure to these food categories, we can take proactive steps toward cancer prevention. Thank you for watching. Until we come your way again, stay alive, stay healthy. Remember, health, vitality, and longevity.